And I'm thinking somewhere else.
I looked it up in the map. I've been in that building. It used to be a social worker. In fact, it's a beautiful people.
Hello everyone, good evening and welcome to this amazing Hearthside Chat on stress, heart health, and hormones, hosted by Have a Heart, Save a Heart here at the amazing space WUUM LA, who made this all possible. My name is Jonathan Joseph, our Executive Director here at Have a Heart, Save a Heart, and it is my privilege and honor to present an esteemed panel of some amazing women who have been doing the work to educate their peers in this community in any way they can for years. It is through the support of generous donors, both institutional and individual, that we are able to put on this type of free programming to those of you who are joining us here in person and those of you who are joining us online. With that, I will leave it to our moderator to make a brief introduction, but before I do, I just want to remind you that if you have your phone, it should be silenced, and if you are watching from home, make sure you are taking part in the chat. That's how you're going to be able to join us for the Q&A session later in the evening. And with that, our esteemed moderator, Jennifer Dickens, who is a member of our newly formed Community Advisory Board here at Have a Heart, Save a Heart. Thank you, Jennifer.
Thank you so much, Jonathan, for such a great welcome. Thank you. Hi, everyone. Thank you for being here. All these beautiful smiling faces, so many of you familiar, and then welcome to all of you online. I know I have a lot of friends and clients, and we have a lot of Save a Heart donors there as well. So thank you all for being here. We really appreciate your presence and your wanting to learn more about hormones and heart health. And I'm honored to be able to introduce this esteemed panel. But before I do, I just want to quickly mention a little bit about myself, and I'm going to also take us through a 2 to 3 minute heart coherence practice to get us all present into our hearts. This is what it's all about: the physical heart, the emotional heart, the resilient heart. So just a little bit about myself. I'm a HeartMath certified coach and mentor, and I work with people to help them develop some personal resilience, get into a state of coherence, reduce stress. I work with individuals, I work with groups, I work with teams and corporations, I work with cardiology patients who have different health challenges, and just help them self-regulate their nervous system. And I love it, I enjoy it. And so that's why Jonathan said, hey, you would be great to be a moderator for this panel. So enough about me. Let's get into our hearts a little bit before I have the panelists introduce themselves. So I'm going to invite all of you online and in person here to just sit comfortably with a straight spine and just gently relax your eyes closed. You can let a sigh out if you like. And take a nice gentle inhale as if you're breathing in and out of your heart, as if your mouth is sitting in the middle of your chest, the middle of your heart, taking in each gentle and slow breath. Softening your breath and softening your heart with each gentle and slow inhale and exhale. Just finding a nice, slow, rhythmic pace with your breathing. And on your next inhale, just breathe in the feeling of inner ease, peace, and calm. Maybe imagine yourself sitting on a tropical island on a white sand beach with the crystal clear water in front of you and lightly lapping waves at your feet, feeling a cool breeze and a warm sun, having nowhere to go, nothing to do, nowhere to be. just allow yourself to just breathe into this peaceful, calm, and easy state. Take a few more breaths at your own gentle pace. And on your next inhale, you can gently open up your eyes and come into our discussion. How did that feel? A little better? A little calmer? A little more coherent? All right. So now I'd like to introduce this amazing panel of very wise women in the health and medical profession, working with body, mind, and soul. And I'd love for Dr. Weinberg maybe to start, and then we'll just come down back to me. But we could start with just sharing who you are, a little bit about your practice, and Dr. Weinberg and a few other of her colleagues are the founders of Save a Heart Foundation. So we'll go ahead and start it off with you.
Yes, so my name is Nicole Weinberg. I'm a non-invasive cardiologist. I practice in Santa Monica out of St. John's Hospital. I have always had a passion for preventative health, which is what I do a lot of in my practice. I am onboarded in non-invasive imaging as well, so I read echoes and stress tests and see patients full-time in the office. And in my free time, we do things like this. So we started a charity to raise awareness for heart disease and hopefully educate our community about all the different things that we can do to stay healthy.
Perfect. Thank you so much.
Amazing. Hi, I'm Stacy Tannenbaum McIver. I am a licensed marriage and family therapist and one of the co-founders of WUUM, the space that you're in. And I just saw two of my co-founders in the row here. This is HAHSAH and Kimmy Mills. So I specialize in women's health, girls' health, and teenagers. I work a lot with just really building up women, a lot of college students and girls, and we work on self-esteem, all of the things we talk about. And at WUUM, we do everything from middle school to pre and postnatal to menopause and offer lots of different services here. And we're so honored that we were able to host everybody here in our space tonight.
Yeah, thank you so much, Stacy, for having us in this really sacred, cozy space. It's like being home, you know?
We love hearing that because that's exactly what our goal was, that people would walk in and just feel really safe and held and comfortable. So we love that compliment.
Thank you.
Thank you.
And Dr.
I'm Noah. I'm an endocrinologist. I do mainly pituitary, so mainly neuroendocrine, which I don't know if you know, but the pituitary is a super small gland just in the back of the bridge of the nose and in charge of multiple hormones in our body. I do see many patients, many female patients in menopause, perimenopause, PCOS, and so on. And I'm a huge believer, and I'm passionate about holistic care, about yoga, about diet, meditation, and so really this place is a perfect place for me to be and to share my thoughts.
Thank you, Dr. Noetel. Thank you. And it's nice to have the panelists here, all of you have some type of integrative practice, for sure. Yeah, it's finding integrative, holistic, and natural remedies where possible, right? Yeah. Preventative as well. And we have Sandy Robertson.
Thank you, Jen.
Thank you.
Hi, everyone. I'm a board-certified holistic nurse, and my background originally was corporate wellness and fitness, but the mind-body started creeping into why people were ill, so I got certified in a lot of holistic trainings. I'm a certified heart math practitioner, do workshops with Jen. Also, medical intuition, and I'm a certified energy healer, and I combine this in a holistic wellness practice. And the people who come to me generally want reduction in symptoms like pain, discomfort, anxiety, and stress. And frequently they represent the population we're talking about tonight: perimenopause, menopause, and life transitions. And they're experiencing a multitude of symptoms across many systems and are confused, bewildered. Frequently they're seeing many doctors and specialists who sometimes operate in silos and aren't necessarily speaking to each other. So again, this is awesome that everyone can be together. And I offer tools and resources for people to know they can have a sense of control over some of the symptoms they're experiencing, whether it's breath work, mindfulness, mindful self-compassion, heart math, biofeedback, or if they're interested in Qigong, yoga, Tai Chi, in ways to ground and nourish themselves, mind, body, spirit, and energy system. So really excited to be here. I know it's going to be a fabulous discussion, and thank you.
Yeah, thank you, Sandy. It's such a renaissance, group of professionals here with us. All right, so looking at, we have a few questions, but we also want it to be natural and there's a flow in our conversation. So we may or may not get to all the questions, but I know that Jonathan had mentioned to me that whatever we don't get to, that the panelists will answer, and then we'll follow up with an email with just more information, things that we maybe didn't have a chance to get to, so that you'll have that as part of your follow-up. So the first question I wanted to pose, and maybe we can start with Dr. Weinberg over there, is that women often think of their heart, hormones, and emotional well-being as separate aspects of health. From your clinical perspective, what are some of the most important connections between these systems that women just should understand, have a little bit deeper understanding about?
Yeah.
That would be helpful.
Well, I think it's a good place to set the stage because, we're talking about hormones and how your body reacts to them. One of the interesting things about hormones is they get released into the blood, and the blood goes everywhere, which is kind of like a very cool thing about the heart. So it pumps the blood all over, and so these little sponges release chemicals into our bloodstream, and they hit your brain, and they hit your heart, and they hit your gut, and they hit all sorts of different things along the way. And not everybody feels all these chemicals in their system, but many people do. And so it's important to understand how everybody's individual process reacts with these chemicals, and then kind of tie them together physiologically so we understand certain aspects of estrogen and what it means when you have a lot of it in your system, or when you have a little bit of it in your system, and when you are putting it in your system, and as it's coming out more naturally. And so the body does react to that. The heart has very powerful reactions to that, and it's one of the hot topics of conversation as we have learned about hormones and how we've kind of tortured ourselves along the way with withholding hormones, or maybe giving too many hormones, and how that reacts to our body. And so I think this conversation is really important because there are certain changes based on research studies and decades of understanding, in more modern terms, how these hormones affect our body.
Thank you. Yeah, because we feel it as women here, we are all different ages, but as we mature, we experience symptomology, and we don't really understand and know what's happening to us because nobody really talks about it that much. And I think that's one of the most challenging situations for most women. But maybe you can also speak more to that, Dr. Tall, since this is your specialty area, and kind of add like the kind of hormones, and there's different hormones too, not just for women's life changes, but there's also how stress, affects as the stress hormones that go through the bloodstream as well.
So exactly, there are so many types of hormones in our blood system that are regulated by multiple regulatory mechanisms, including the pituitary, the hypothalamus, and other organs. And also our metabolism and the bodily needs. I think one of or a few hormones that are important for women health and also for most of the people health is the estrogen, of course, in the perimenopause, menopausal system. Estrogen is very important cardiovascular wise because it helps to open arteries, it releases nitric oxide, it works on insulin sensitivity. So actually when you are going into menopause, you're going to have more insulin resistance. It also works on blood pressure via regulation on the kidneys and other hormones there. And another hormone that is super important is the cortisol. And I think during menopause, perimenopause, when we have all these changes already going on in our body, we also have a lot of stressful events in our life. We have maybe kids that are graduating and leaving the house. We're taking care of all of our family members, maybe changes in our job. So this stress and this life condition also increases cortisol in our system. And again, increased cortisol also similarly have a similar effect to decrease estrogen, which is increased insulin resistance and increased blood pressure and so on. So really this time in your life when your estrogen is going down and your cortisol is going high is not really optimal for us. Other hormones can be thyroid. Many females have hypothyroidism or hyperthyroidism that can also impact these systems, insulin resistance, blood pressure, heart rate, and so on, and also mental well-being, right, and quality of life.
Mm-hmm. And so maybe between the two of you, Dr. Weinberg and Dr. Tal, maybe you can share some of the physiological changes that we might experience in our body besides the hormones in the bloodstream. You know, what types of things might we feel? Because I think that is the one of the things that we think, oh my God, I've got to go have knee surgery, or my joints are all achy, or I don't know what's wrong with me. My blood work is showing everything is normal, but I'm having all these things go on, and a PCP might not even really guide us to an OBGYN or an endocrinologist or a cardiologist, but we're having heart palpitations, or so just.
Well, it's kind of funny because you've kind of hit the nail on the head. When you start to highlight all these different things and it's like all going on simultaneously, you start to think, okay, well, is it really orthopedic, or could it be just GI, or maybe it's all of these things, and maybe it's a hormone issue. And I feel like that's sometimes where as you're teasing through somebody's history, you don't necessarily want a patient to come into the cardiology office and you just ask about the heart. You want to ask about all the different things that are going on in their body, as well as other medications that they're on, supplements, how they sleep. As you were talking, Dr. Tal, I was thinking, how all these things interrelate with sleep and our weight changes. And so when it's starting to hit multiple different organ systems, then you start to think, okay, what are things that could be hitting multiple different organ systems? So hormones clearly are one of those things. And estrogen, if we're just kind of highlighting, we're kind of tiptoeing around getting into the meat here, but estrogen is a super powerful hormone. It affects so many different things, but within the cardiovascular system, we've seen a lot of the benefits associated with it. It does cause this vasodilation, so kind of plumping of your blood vessels, which is really good. It keeps your blood pressure low, keeps things functioning well. It can cause some, changes to your cholesterol, like some larger, fluffier cholesterol. So, maybe you're not depositing plaque as much. Maybe you're having less oxidation, less calcium deposits in your blood vessels. But then there's the flip side of the estrogen, which can be things where you can form more blood clots, and you can have some plaque rupture associated with that. And so it's this fine balance of figuring out individually where you are in your body at that time, and hopefully your team, your kind of global medical team, can help you figure out what are going to be the best ways for you to navigate some of those changes. And some of it may be very cardiac in origin, but some of it may be other, organ systems and other feelings to your body.
Do you
I was
want-
gonna say, I was looking at the mental health
Okay.
component of it.
Yes, I was gonna,
right?
Yeah.
exactly, I was gonna come to that, yeah,
Yeah.
for sure as well.
Oftentimes, I will have someone come to me and think, oh my gosh, do I have late onset bipolar disorder? Because I'm so hot and I'm cold and I'm angry. I used to be so nice. So I see a lot of people, it's hard to differentiate. Also, I have a good friend who's an ER doctor who sees hundreds of people coming into the ER thinking they're having a heart attack when it's actually a panic attack.
Yeah.
Right? So the anxiety, all these things mimic. So you've got the mental health piece, the medical piece. So it's all fascinating how it all very much ties together.
Yeah.
Yeah, I agree. So many common symptoms that I see in patient coming to me for perimenopause, menopause definitely disrupts sleep. They also affect the stress level, the panic level, and the entire way they function during the day. Joint pain, like you said, hair loss, fatigue, irritability is a big one. Yeah, I think those are the main symptoms. And hot flashes that we all know this is number one associated with menopause, however, and also one of the only indications that hormone replacement therapy is actually for, but the symptoms are so much wider than hot flashes.
I will say though, I find it a little bit interesting, and to your point, you know, when patients come in and they're describing their symptoms, and you kind of go through the things and like you suggest like maybe there are some hormone issues, there's like this little bit of like, are you really sure? You know, like I might be, you know, you do want to kind of tease through some of the other stuff, but I find, and I don't know if maybe you get to patients when they've kind of checked a bunch of the organ system boxes, but I feel like sometimes when you do some basic testing, like if somebody comes in to see me and they're like having heart racing and, you know, they, you know, maybe have fainted or something, there's different things going on, and you kind of tease through like a heart monitor and an echo, and you kind of make sure that they don't have anything really bad going on, because of course, and then, you know, you may suggest like there could be something else, or like, oh no, and there might be, there's definitely a cardiac problem.
Definitely, yeah. So your patients are more in the cardiac side, but I usually rule out hypercortisolism and hypothyroidism and other pituitary disorders, elevated prolactin, and so on. Yes. So obviously rule out the bad stuff.
And like the checklist.
Exactly. Yes.
And to add to the puzzle, sometimes there are gut and digestive issues that people are talking about. And it could be, there's so much talk about the gut microbiome and the gut-brain connection, and that it's bi-directional. So they're having symptoms related to perhaps depression, sleep issues, and gut issues. So once again, they need someone who can look at all these symptoms as a whole picture.
Well, I'm glad you brought that up, Sandy, because we don't want to make it sound like all doom and gloom as we mature and get older, you know, but, you know, there's a lot of things that happen and we think that, oh my God, something's seriously wrong with me, but there are remedies and solutions and things we can do with our health, with our breathing, with our exercise. And so I'm just curious, when it comes to some of these transitional life changes, what do you recommend for your patients as a protocol, as you know, we're going through different cycles in our life? You know, do you have a specific protocol or recommendation?
Well, I will say, you know, one of the things, as you were just talking, I was thinking, one of the things that has been kind of a negative was there was a big study that was published in the early 2000s that showed that with hormone replacement therapy, it was a little bit of a broad term, hormone replacement therapy caused an increased rate of stroke and thrombotic events in women. And so it was like this kind of terrible dark time where like all the women that were kind of happily going along in their hormones, they were off, you know, and then for quite a long time, I kind of feel like maybe just the past 10 years, we've been talking about adding hormones back in again, but for a period of time, it was like the dark ages, like don't take that, you're gonna die. And then everybody was like really struggling for a very long time. It was almost like this resurgence of all these symptoms and stuff that had really been kind of quieted by oral hormone replacement therapies. And then I think that over time, there has been a better understanding about the different effects of oral therapies versus topical therapies versus, different ways to get hormones and different types of hormones into your system. And so I do feel like we're in this kind of exciting time where we actually can make people feel better instead of just saying like, well, it's going to be awful, so get through it. So, I think it's actually like a very a wonderful time in medicine because, we can still see the patients and they may come in with, chest pain, or they may come in with heart racing or fainting spells or blood pressure changes or all these different things that maybe I see in my office, and we can kind of check the boxes and hopefully make sure that they are safe. But then I think that it's not like the door is closed in terms of what their options for therapy are. There's many different options, and I think our universe is much more open to those things now than we were. And we, like in a time where we couldn't really talk about it, was like, this is like going to be so bad if you're on those drugs.
We're talking so much about it. Here at WUUM, it's such a topic of conversation. And I feel like we had mentioned earlier that women weren't talking so much. I feel like we're in this beautiful place where we are talking so much more, and we're talking in community, and we're not struggling and isolating as much. I think we're really talking about it so much more, which, like you said, it's a beautiful thing. Because we, our mothers, or until recently, never talked about these things, and now we're in a place where the conversation is happening, and it's going to continue to happen. It's such an amazing thing to see. I feel so fortunate to be a part of that conversation.
Yeah, and also I think it's, led the way that so many postmenopausal females have osteoporosis now. Right, so this is a harm that we've made, and now they need to get more medications in order to treat that. So this is another part of that. Yeah, where the discussion was only on hot flashes and treatment only for hot flashes, where there's so many other symptoms for menopause.
Yeah. And I think that also, and I think one of the things that I thought was kind of interesting as I was taking care of patients was, it was like oral therapies, or that was it. And then they started to do all these different things and putting pellets and doing all sorts of unusual things. And now that I think things are a little bit more standardized, I don't know if you now see many more people doing things that is kind of like, this is your prescription drug therapy that you can get from the pharmacy, and it's not going to be something scary or crazy. You can, not do something that's going to maybe totally fluctuate your blood levels, because I think that also had its host of dangerous things that went on with it.
Yeah, super therapeutic levels of estrogen or testosterone, which is dangerous.
And then I know that a lot of women do use bioidentical hormones, and that has a little bit of risk as well. It's not completely risk-free, but I was wondering if you could speak to that as well.
Yeah, so we can just clear a little bit. So bioidentical hormone just means that they, the chemistry is similar to the one that we have in the body. We do have FDA-approved bioidentical hormone, which are prescription medication, which I recommend. On the other hand, you have the compounded pharmacy. They do either bioidentical, not bio. I do not know what they do, but I also cannot really trust them, right? Because those are not regulated. I have a friend, an endocrinologist, who had patients coming after they went to a compounded pharmacy because they started to have weight gain and purple stretch mark, and apparently the pharmacist in the compounded pharmacy put steroids inside the compounding formulation because he thought it would be better for absorption. So it's really on the pharmacist himself or herself to know what exactly in it. So I don't know if I'm all about bioidentical, but they should be FDA regulated.
And one of the things that we had noted with like oral versus some of the topical versus some of these different things is the way your body processes them. And one of the big things that that did put women at risk was the oral pills have to be processed by your liver, and so they can activate different cascade mechanisms that could predispose you to clots. And so now that we have a lot of these very interesting topical therapies and patches and things like that, you are not having to have the active products of the drug go through your liver and activate this hypercoagulable state, this increased clotting state. So you could actually have some of the effects of the drug. So, and then I think you can kind of titrate up your therapies accordingly.
Yeah.
So.
Thank you. Thank you.
So that's where some of that black box.
Great insights. Great insights from the
The
experts.
black box warnings kind of came from.
And that's been removed. correct?
And the black box warnings, I don't know, you could probably speak on that a little bit more, but
Yeah.
it's my understanding that was kind of a
So
big highlight.
the cardiovascular and the hypercoagulability for systemic estrogen when it's you still have increased risk for a hypercoagulability, but less with the transdermal.
Right.
Yes.
And a lot of it depends on how much is kind of absorbed into your body. Yeah.
And with these changes in our hormones and our bodies as we transition and mature throughout, throughout our lives, the hormones also affect our autonomic nervous system, pushing us into the sympathetic nervous system where cortisol, adrenaline, and then we have the stress responses occurring. And would you like to maybe speak about that and what you see in your patients and what you recommend for them also to help them get back into the parasympathetic, get back into a more coherent state, because it also definitely affects mental health, emotional health, mental health. We talked about a little bit about anger and also foggy mind, things like women aren't able to think like they used to. They get all like, I used to be so sharp, and now, they're a bit foggy in the morning. And sometimes a lot of women will drink coffee first thing in the morning, which spikes your cortisol even more. So not always the best thing, but you feel like I'm more with it, but maybe not the best thing to do.
And after you explain that, I was going to talk about the cortisol. Maybe you should talk about that a little bit. And I was going to talk about ways of bringing it down, because what you just mentioned about coffee, there's such great morning and nighttime routines that we could implement, because we want that cortisol level to drop. And when you go right to coffee or you go right to your screen in the morning, it's just shooting right up, and that's our goal, is to reduce it. But
Well, I was going to say, along those lines, let's talk about sleep, because that is, I think, something that many people, that goes away. The ease of falling asleep, the ease of staying asleep, the benefit that has on some of these hormone regulations, and the different ways that we could kind of mitigate that through different techniques. Because as you were talking earlier about all the different, every single hormone that you listed, I was like, there's sleep
there are so many.
And that is something that within the cardiovascular literature that we're highlighting very significantly, that people that do not get enough sleep, they gain weight, they have blood pressure issues, they, those cortisol levels spike in the morning. Those are times where they're more predisposed to having heart attacks and plaque rupture. And so I think those things are very, very critically important as it relates to, your full body health, not just cardiovascular, but really getting good sleep.
And we talk about sleep hygiene. And Sandy, you should definitely pipe in, but talking about at night, creating a peaceful environment before you settle in for the night. And that might mean your phone is in a drawer. You put it away. It's not on the top of your end table. The blue light, everything, you just put it away. And yes, is it hard initially? Do we have to work to get comfortable with that? Yes, but there's taking a bath at night, having sleep hygiene, implementing a good book that you're reading, spending time with your family. And then in the morning, we're talking about, again, you have to practice. It's hard, but you don't reach right for your phone. And I have been doing this for months, and it's so helpful. I don't go right to the phone. I immediately get sunlight and go in my backyard and just see where the sun is. And even if it's the most awkward spot, I just crisscross applesauce in that direct sunlight. And And then water before caffeine, which was really, really hard. But that having water with lemon and hydrate before we jumped to the coffee, that was the hardest piece. That definitely took a while for me. But I can't tell you what a difference it makes. And you really notice when you're having these sleep hygiene and you're implementing good going to bed and waking up rituals. It's such a crucial part of our sleep and our well-being.
I just want to mention the pharmaceutical. And no, like that. I totally agree about with everything that you said. But progesterone for perimenopause, menopausal female, just does wonder to their sleep. This is one of the things that I hear so much from patients that I'm starting on hormone replacement therapy, that their sleep has just became much better. They don't wake up. They wake up. They don't wake up during the night, and they wake up refreshed.
Oh, absolutely. Yeah. So the HRT, these are all a combination of things, but absolutely the progesterone and the estrogen, and then implementing, and also for people who aren't on board with HRT, or they have a family history for whatever reason, then I talk about all the sleep hygiene things
together.
If they're not on their.
It's together. Yeah.
Absolutely, being the best.
And adding to the holistic tools that you mentioned, Stacy, they're different for everyone, what works in terms of sleep hygiene. Some people love to listen to the Calm app. There are other mindfulness apps. Some people don't like that. Some people like music. There are noise machines, that sounds of the ocean or animals. I encourage my clients to track their sleep patterns and notice what they were eating, what they were drinking, whether caffeine or alcohol. A lot of people have trackers on their phones and can assess the quality of their sleep. But the most important message is it's different for everyone. So some people might love chamomile tea, or some people might love lavender, and others don't. But finding the right sleep hygiene tools that work for you, trying different things, I think makes people, again, feel empowered that they have some things they can try, and hopefully a combination of them will work.
Yeah, and getting a full night's sleep is one of the most important things to feel resilient the next day. It's the most replenishing, renewing thing you could do for your body, is to get that full night of sleep. And maybe even try meditation in the evening before as you get into bed or before getting to bed, do 5-10 minutes of meditation, because the minute you try and meditate, you're probably going to fall asleep anyway. So that's another just little tip. But also, so we talked about a good night's sleep, some good sleeping patterns, but women are juggling a lot of responsibilities these days, and so we have a lot more stress and overwhelm, which stress and overwhelm can create deep anxiety and result in, heart disease, can result in mental health challenges and other physical ailments, depending on where that stress is suppressed. I work with my clients, I say, what you don't express gets suppressed, So what would you suggest for us to do or what do you do with some of your patients or clients and recommend for them to get into that state of inner peace and calm and inner harmony in the midst of everything that they have to juggle on a daily basis?
So from a personal point, I know on myself, when I don't practice yoga regularly, I'm a less nice person to my husband, to my friends, to my kids especially. So I know that taking care of me makes me better for them.
Good, I love that.
This is like, and my husband knows that too, and it gives me the space for that. So really understanding that we have to take care of ourselves, especially as mothers, as females, as spouses. We have to make sure that we are in a good mental state. So take the time, but also know that it's not 1 or 0. It's not nothing or everything. Even if you have 10 minutes a day, then do 10 minutes a day. You don't have to now do like an hour and a half Ashtanga yoga practice every morning. It's good, but you don't have to. So really take it step by step, but make the time. Put it on your calendar.
Yeah, that's great
Yeah, I
advice.
read something that as little as 5 minutes of just sitting still and being in the moment can reduce anxiety. Your central nervous system just kind of slows down, right? And I love the fact that you said people will come to me and go, well, I can't go to yoga, I can't afford it, it's too long, all of these things, and you have to counteract that with, let's try things that are manageable. Let's start small. Let's start with the 5 minutes. Let's get into down dog for a few minutes. Breathing is free and a great activity.
Yeah.
But yeah, I love that you said that, because a lot of people do think, I don't have the time for fill in the blank. So I love that you said that you can do things that are going to help a lot in a very short amount of time.
Exactly. Instead of scrolling.
Yeah. Yes, that's right. That's right. And Sandy, how about you? I know this is your space. This is your helping them bring it all together and have that more holistic approach to well-being.
Well, the main thing I talk about is personalizing the self-care plan, just like what all of you were talking about. So it's different for everyone. Some people don't like to meditate, but they could go out and look at nature, look at trees, look at the sky, look at flowers, or pet their animals. And breathing techniques are core. Knowing what nurtures you. So mind, body, spirit, and energy system. Once again, it's different for everyone. Some people love affirmations, prayers. So the combination of saying things to yourself in terms of resetting the mind and the messages to self. Body, what are you doing for movement? Spirit, what are you doing to nourish your soul? Of course, what you're eating and nutrition. And exercise, but that can be movement. When people say to me, I don't have time to exercise, I say take 15-minute increments several times throughout the day, starting in the morning. Take a 10-minute refresh break. You know, if you're working, go outside, look at the sky, look at the tree, look at nature at the end of the day. So ways to quiet the mind and body are different for everyone. They're personal for everyone, and it's all good. So that's what I recommend, really personalizing those self-nourishment tools.
Thank you, Sandy. Yeah, one of the things that I do with my clients is try to help them think about and consider what do they enjoy doing, right? Some people like to walk. So you can do your heart math breathing or your self-regulation breathing while you're going for a walk. You can walk to the park. You know, you can sit in the park and do your breathing. Getting outside, like one of you was saying, you were saying, Stacy, get into some sunlight, especially early in the morning, late in the afternoon or evening, is such a great remedy. I am fortunate enough to live here in Santa Monica, so I walk to the beach often and do a beach walk, especially if I'm having a tough day, a hard day. I'll just drop everything and go. And the person that comes back home from the beach is a completely different person than the one who walked there. You know, there's just something about being in nature and breathing and taking a moment and being silent and still that is so replenishing to your heart, to your soul, to your well-being, to your, to your entire being. So something to think about for yourself as you look at, you know, what is it that you're going to do? And even exercise. Exercise is so important to release the tension that's pent up in your body. You have to have, I feel, a self-awareness of your body. And like, if I don't go to the gym once every 2-3 days and do weights or do my dance class, it's like I get really grumpy. I'm like, what is wrong with me? And I'm like, oh my God, you haven't been to the gym in 3 days, you gotta go. So I just drop everything and go. And it's like, I shower, I leave there, and I'm just like, whew, everything is fine. And I realize that our body holds tension, and exercise is a great way to release tension. You know, especially for men and women, but especially for women who are juggling a lot of responsibilities. They think, oh, I don't have time to go to the gym. Well, that's part of the self-care. You don't have to go, for an hour or two. You can just go for, half hour and come back, or go for a run, or whatever it might be for you that you enjoy to do. Or even dancing. You can go dancing at night. I feel all women should dance, period, whatsoever. All right, let's take a look. How are we doing on time?
We're doing wonderful.
You were doing good? Okay.
Yes, we are doing wonderful.
Okay, perfect. So let's take a look at staying on the topic of stress since we're here. Well, I should say, okay, so I think we covered it pretty well, right?
I do want to add something,
Yeah.
one more thing. Community. I think we
That's a
all
good
should
point.
have a group of friends, either like-minded or not. Sometimes it's also good to have different opinions, but really someone that you can call family that are not your family. So you can go dancing with, or drinking with, or eating with, or whatever, or doing sport, but having someone that can really share your journey with you. I think this is important
That's
also.
great advice.
And
Great
to
advice.
more on that,
Yes.
absolutely. That's
Very
the
important.
two words we hear here all the time is I'm craving connection and community. Absolutely. People come here, they gather together and talk and decrease isolation or talk about hot topics like HRT and all the things that we talk about here. But you're absolutely right. We need to have friendships, people that bring us joy. Having good boundaries too, about the B word, right? Boundaries, like having solid boundaries and being around people that make us feel good and bring us joy, and saying no to things that we don't want to do. And I think boundaries, connection, and community are three incredible things that we can be doing for ourselves.
Love that. Love that. Yeah, and also because as we mature, as we mature, like I see this with my mother, God bless her heart, she's, for the most part, healthy in some ways and not healthy in other ways, but the thing that I notice the most that I feel is contributing to her decline as she's aged is isolation. It's the isolation, right? We had COVID and people were isolating, and she's 80, and so she's lost a lot of her best friends, right? And at that age, it's harder to make more friends. But if, so I always encourage her to get out, with her brothers and sisters, and the family comes and spend time with her. But having friends, having community, finding something that you enjoy doing, volunteering. I tell her, go volunteer at Descanso Gardens. It's right down the street, and we've been members there for a lifetime. And she loves gardening, So really move out of your comfort zone as you get older, to not isolate and to just really get out there, connect with people, say hello. Like, I love that all of you are here. This is what WUUM is about, is creating community for women and having a place to go, and a sacred place, and feeling comfortable. And it's nice, I say, to be heart to heart with each other, because our heart has an electromagnetic field, and we all, when we share kindness and caring and love and joy, we all feel it, and we all share it with each other. So,
well, and I like that you brought up your mom and kind of the things that she's going through, because I guess one of the things that I was thinking, as I'm sure time is going on here, is that what we say to certain age groups as they're remedying things that are going on in their universe is not what we would say to every age group. And so particularly when we're talking about drug therapies and hormones and things like that, there are certain age groups that we would steer that towards, whereas there's others that would be considered quite dangerous in. And so it is nice to be able to have your toolkit and arm yourself in whatever way you need to, because I think as a medical practitioner, the last thing that I would want to do is, meet somebody who is, a few decades after a hormone change in their life and start needling with hormones in them, because that would maybe not be the right route for them. That could actually be quite dangerous for them. But you would want to maybe advocate for exercise, better sleep hygiene, relaxation techniques, and things like that. That may be a very different conversation than you're having with your 50-year-old who's coming in, who's perimenopausal, who's dealing with all these different things. That may be an age group where you would say, okay, this is a very reasonable, option for you. And there are different physiologic things that happen in our body that would make you benefit from hormones at certain stages of your life and at risk for hormones at other stages of your life.
yeah, good point. Very good point, Dr. Weinberg. Thank you. So, before we wrap up, I just want to, and we're going to have some time for Q&A, but I wanted each of you to just share what what would you like, what takeaway or any takeaways or final recommendations for improving heart health, for improving our endocrine system, for improving our mental health, improving, the full mind, body, spirit. So, each of you has your expertise area. So, just, one or two takeaways. Maybe Sandy, would you like to start? Yeah.
The first thing that comes to mind is find a doctor who will listen to you and will really pay attention and understand what you're saying and not be shocked by some of the things you might be interested in or reading about. And also go to that doctor with things written down, the collection of symptoms you've been experiencing, whether how many days a week or times of day, because that will be valuable information for you to take to your doctor. And the other thing is there's a circle of health, also called a wheel of health, that has power of the mind, connection, food, movement, spirituality. And think of your own circle of health and what am I doing to create whole health for myself, and where might I need to ratchet it up a bit. So it might be connection and community, and what can I actively do to create more community? It could be sleep. Sleep is on the wheel. What could I actively do? The quieting the mind tools to decrease anxiety. So thinking of your life and your whole health in a holistic way, how are you nurturing your spirit, will help you feel more empowered, and again, be able to go to your doctor's team with this valuable information. So that's what I would recommend.
Thank you, Sandy. Thank you, Dr. Tom.
I think it's important to find a doctor that listens, but it's also very important to speak for yourself. So advocate for yourself. Don't just say this is just aging. Really, if something is bothering you, understand what it is and try to take care of that with the help of a physician or a practitioner. Really put yourself first, because it's going to help with the hormonal status in the body and also will help to mitigate risk factors for cardiovascular disease. So it's not really about just, oh, I need to feel better. It's really, like you said, it's a holistic approach. So, yeah.
Thank you.
Oh, we have so much stress, so I look at it as we can't eliminate it. It's just not realistic, but what can we do to reduce it? So the takeaway for me would be self-care. Like you said, put yourself first. We have to take care of ourselves to be the best partner we want to be, the best, whatever it is, the parent that you are, the best friend that you can be. And so, although some of the things I talked about might be challenging when it comes to the sleep hygiene, but start slow. Like tonight, maybe I'm just going to put my phone away 20 minutes earlier than I usually do, or I'm going to have water before coffee today. Whatever it is, just think about those things, because I really believe that stress reduction is so important. We'll be so much healthier. We can't eliminate it, but we can reduce it.
Thank you, Stacey.
Well, I guess my takeaway would be that everybody is an individual, and you obviously know that, but what you bring to the table in terms of your genetics, your family history, the stressors in your life, the things that you've tried in the past, where your hormone journey is. Are you pregnant? Are you postpartum? Are you perimenopausal? Are you postmenopausal? All of these different things tell the story of who you are, and your practitioner would hopefully meet you where you are and treat you as an individual, not necessarily open up the textbook and point to page 16, but to actually say, okay, this is a woman who's dealing with X, Y, and Z, and how are we going to find a treatment plan for her that's going to give her peace of mind, give her longevity, get her on the right path so that she is actually feeling better. Because most of the time that's why people are coming to you. They're having some sort of struggle, fill in the blank, and they want to make sure that they don't have something bad. Okay, so do some testing and prove to them that everything's okay, but then also put them on a path of understanding of what is going to keep them safe for the long term, and that's going to be super important. So really crafting your own individualized journey.
Thank you, Dr. Weinberg. Yeah, and you know, the preventative approach, you know, a lot of what we've been sharing is ideally you self-care, you know, and having a conscious awareness of your body so that you're healthy and well, and like you said, noting some of the changes, that if you do need to go to a doctor or a specialist, that you have a conscious awareness of your body, your mind, some of the shifts, some of the changes, to the best of your ability. I think it makes a big difference when you walk in, instead of saying, I don't know what's wrong with me. You're right. So anyways, thank you so much. That's all of the questions we have, but we wanted to open it up for the group here, and I know that there is a chat online for those of you who are online and have some questions for the doctors and the practitioners here on the panel. So if you have, perfect. Thank you, Saskia.
Hi. Thank you so much for all this beautiful information.
Are we going to use a mic, or what do you want to do? Oh, it's not working. Okay. Thank you, Saskia.
We'll repeat it.
I know Saskia can project her voice. She's very good at that. She has a beautiful voice.
So my question is, what do you feel about frequency therapy? Because I work for myself with frequencies. So I think the future is not that we take a pill, that we listen to frequencies and our body responds to that. For example, yes, I still have my period, but the thing is, I have also sometimes cramps or migraine, so all these symptoms. But then there is so much study out there and so much amazing books, and then I work for myself with a certain frequency. I don't know the number, sorry about that. That is especially for my body reacting to menstruation pain. So I put it on my phone, and then this is just like, woo, 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 woo. It's horrible. Because I'm a musician, it's horrible. But the thing is, my body starts to relax, and it needs a moment. It's not a miracle thing. Maybe it's not so fast like a pill or something, but the body has not to digest all these side effects of the medicine that we take. So frequency medicine is on the rise. So many books are out there. I just can just say, look into it. And then when I listen to it, I start to relax, and my body, the hormones start to go down, and I have not so much cramps. Sleep as well. When I listen to a certain frequency, and it has to be not close to me, you can download, you don't need the internet, you have it in your room, and then I sleep so good, but I don't have to take a helper. I love tea, that's okay, but it's just like, what can frequency do for me? Because that is kind of like the future of healing, so that we are safe with the side effects. So what do you feel about frequency healing and using frequencies? I mean, they are all out there, all. Sleep, stress, focus, when you feel foggy, hard energy, so it's out there, and it's on the rising side. So it's coming as a big wave.
Sure.
So what do you feel about that?
Yeah, do any of you work with frequency or are familiar with it? No?
But we want to learn more.
Yeah, I just have like something small to say. Two things actually to say. First of all, our entire brain works on frequencies. That's how the brain works. The action potential, how the nerves, how the neurons connect with each other. You need a frequency of multiple types of multiple cells, and then they trigger together, and it's all about frequencies. And that may be what helps relax and to change. I don't know a lot about that, but I do understand how it can help. I'm sure that like we prescribe different types of medications, but I do prescribe a lot of hormones. And I just want to say that what I say to patients who don't want to take hormones, not specifically for hormone like estrogen, progesterone, but any types of hormone that they have to, that hormone is not like any medication that you're taking, because it's something that your body actually makes by itself. And specifically for menopause, perimenopause, having menopause is good for the species, right? The evolution didn't want a 60-year-old female that may die in 20 years to have a baby, right? So it's very good for the species, but not very good for the individual. So this is why our ovaries are dying at the age of 50 something. And the hormones are not, the estrogen, progesterone, the bioidentical ones, are not a medication like you're taking a medication for heart hypertension, which you should take if you need to.
Yes.
But those are really substances that your body makes by itself.
I think it's just nice to support the body in other level and to have another view of like
You can have it all.
what else is possible, because
Yeah.
we are very powerful. We are
Yes.
more powerful than we think, and
Yeah.
when we give all the responsibility to something that is outside of us, we cannot step into our power. And I think this is something that's, I mean, I'm my own experiment since 14 years, and it's working on some place, but of course it's on the rising. I say it's coming. It's not. It needs time to all the studies and
Yeah.
all the. I mean, there is so much to learn. I think the next 200 years is so much. To
Thank
learn.
you,
But
Saskia.
Thank you
Thank
so
you.
much.
And we do, for anyone who's joining us and asking a question, from our symposium this past February, we have some lovely honeybee beeswax photographs.
Thank you for your question. Yeah, bees. They definitely buzz and have frequency.
Nice.
You
Yeah, they have
manifested
frequencies.
There you go. Anybody else here? Oh, we have a few questions.
Hi. So I just have a question for women that are in postmenopause, and I hear two different sides of this. I've heard that you don't need to be taking HRTs once you're postmenopause. That HRTs are for when you're in perimenopause to help you make that transition, but once you're in menopause and out of it, or you passed your year or whatever, you don't really need it. And then I also heard the opposite, that you can take it, and I personally don't want to be on it for the rest of my life. So I'm just wondering, like, when do you stop? And like, what do your levels just are generally going to be low at a certain age anyway?
Yes, because at a certain time, around age 50, your ovaries are not working anymore, and the ovaries are the glands that produce estrogen and progesterone, so you're just not gonna have it in your body. Until when, it's up to you. I'm not gonna make anyone take anything that they don't want to take, but I do think that those hormones are important for your cardiovascular health if taking at a certain time, not like you said 20 years out of menopause, not if you have elevated risk for cardiovascular disease, or if you have personal history of hormonal cancer. So they are important for your cardiovascular, for your augmentation, for your overall quality of life. There are side effects which we did not talk about. Like I do have patients, with vaginal bleeding after we're starting, with breast engorgement that they don't like. So it's all about risk versus benefits, side effect versus how it makes you feel. So there isn't really right or wrong. It is important for your bone also, which I didn't say. So it has a lot of benefits. It has also side effects. The only one that should decide is you. We can only offer.
There are some studies about the timing hypothesis, and I feel like we kind of danced around that a little bit. But the timing hypothesis suggests that you should be starting hormones as you're perimenopausal and your hormone levels are starting to be low, and then you're really on it for, I think the studies say up to 15 years postmenopausal.
I was curious about that.
I think that's like just because the study was 15 years.
It could have been.
Yeah.
The issues, a lot of them have to do with once you have calcification on your heart arteries, once you have established disease, once you start putting hormones in your system, and again, depending on different thresholds, and unfortunately everybody's body, this is still kind of where we're learning things, how much drug comes into your system, that does put you at risk for a variety of different things if you've already got certain disease processes in your system. So I think to your point, maybe the research studies kind of suggested things that are still being studied quite extensively, but I don't know that the goal is to keep patients on it forever, but it is to kind of time it such that you get over a certain period of your life if you're having certain symptoms. But just because you have every woman is going to not have that, maybe not every woman is going to become perimenopausal and lose her period, that if you're having symptoms associated with it, you don't have to struggle and not do anything about it. But of course, if it is a struggle and you want to be on drug therapy for it, there are options with your practitioners hopefully can keep you safe and make sure that your disease state is such that it's not going to be aggravated by those chemicals in your system.
So
Such a great
wondering when
question.
you get past the struggle, and at this point I feel like I don't know if they're doing anything for me anymore because I don't have any of those symptoms. I'm past that. Like I don't have any of the symptoms. Is there a range where the levels of estrogen, progesterone, and testosterone should be like for women? I mean, I'm 53, so like I'm postmenopause, so like if I'm looking at my lab work, like should there be a range? And like my PCP isn't really
Yeah, we don't really have a range for progesterone. We don't check because there's either a 100 milligram pill or 200 milligram pill, right? We don't really have a place to play there. Estrogen, we do have multiple, if you're using the patch, so you have multiple, many doses. I usually target 30 to 80, but it's not something that is based on evidence, so we don't really have like 30 to 80, but again it goes with the symptoms. So if I have a patient that is 31 but she has vaginal bleeding, I may go down on the dose, or she has breast engorgement. So it's really individualized. Like we said, everything here is individualized. We don't have good ranges. We're not there yet. Hopefully we will have. It's not like in male, then we have hypogonadism, low testosterone, then we know exactly where we want to be. It's not the same. Not yet, at least.
Yeah. Thank you.
There's some other questions.
Does someone have a question?
Yes. Thank you so much for your question.
So to the doctors, are you accepting new patients? I always ask this because I hear panelists and I'm like, I want to see you. Sorry, my book is closed.
Oh.
I always find time.
Oh, thank you.
That's a good answer.
Dr. Dr. Weinberg?
Dr. Weinberg?
Yes. Short answer, yes. We can chat afterwards.
Okay.
Good.
And you said you only prescribe FDA approved medication, so I've been speaking with my PCP, and yes, the lowest dose of progesterone is the 100.
Yeah.
Well, I had an HRT specialist see how sick I got and put me on 25 milligrams of progesterone. I upped it to 50 and had a full-blown panic attack, on fire, body, I'm still shaking. And I have this adverse reaction to the oral progesterone, but my PCP is like, you have to get up to 100, I'm conservative, and I need to keep you healthy. So these are things that I really need to work on.
So what I would say for that specific question, which is very specific, but I will just say briefly, one, you're talking about the FDA regulated progesterone, not something, the 25 that I don't know what it has.
Yeah.
Okay, because I don't know what the 25 has. You need a progesterone to mitigate the estrogen effect on the uterus. You have to have it. 25, it's probably a lower dose, but I don't know if we have any studies comparing 25 to 100 to saying it's like protective. I don't know that. You can potentially think about an IUD, a progesterone secreting IUD, which is local, and you're not going to feel the entire symptoms, the systemic
You don't feel
symptoms.
the symptoms because I'm so frightened of putting something permanent in my body when I'm
It's not permanent. Yeah.
sensitive. I just,
Yeah.
it's in there. I gotta stop the pill.
So that's something that you can think of. And plus, there are also patches that have estrogen and progesterone together.
I couldn't take the estrogen patch. I'll talk to you
Okay,
personally.
fine.
Yeah.
But yeah, if you
Yeah,
guys are
that's-
accepting patients, thank you.
Thank you for your question. Are there any questions from online at all? Do you know?
No, we
No? Okay.
do not have. Oh, wait. Nope, just someone who is 73 on HRT for 20 years, feels great, and will never stop.
I have no issues with
That's
that.
some serious feedback.
Nothing like all the things that we ask people. Oh, yeah.
Oh, we have
your
one more
personal
question,
question.
Rosia. Yes, Rosia.
Hi.
Oh, it's too good.
I guess this is kind of a comment, maybe a question. So I actually did HRT for a couple years or so, and it worked great for me. But then I decided I kind of want to just do something more natural, and I researched, and I had a friend who recommended Chinese herbs.
So I've actually been doing that because it regulates, you know, your whole energetic system. So I thought, let me just try that and then I can compare. And actually, it's been working well. I've probably been on them now for, I don't know, maybe a year or so. And, you know, I've had, you know, symptoms reduced. I never really had crazy symptoms. My body's pretty resilient overall, so I felt safe kind of going that route. So I was just curious if you had any comments about that. And I kind of feel like at least it's also maybe an option for somebody who maybe wants to do HRT for a certain period of years and then try something that's just more natural.
Interesting.
I have things to say.
Did you? Dr. Tal?
Yeah, I know, yeah.
You don't?
So I think that for me the main issue would be your bone. So just make sure to do a bone density scan every 2 years, making sure it's fine. Yeah.
Yes. Thank you.
Along
Thank
the
you.
lines of more natural too, do you, any of you, each of you, all of you, do you have any recommendations for herbs or supplements that you would just say, these are really good for heart health, because we're looking at heart health among all the systems of the body, along with HRT or BHRT or on their own, but would you, and I guess along those lines, would you recommend something like taking your vitamin K with the D to keep the calcification out of the arteries and putting it in the system where you want it to be, things like that, and also herbs or citrulline or different CoQ10 or herbs too. I can't name them. So, yeah.
Do you have any like dietary exclusions? Like, are you vegetarian? Are you? Yeah.
No, I don't.
Okay. Because I mean, I guess
Food is,
the mantra would be,
food is medicine.
yes, if you could eat it, you should probably get it in that way. I think I always recommend to my patients a good physical with a general medicine doctor to check vitamin levels and things like that, so that you know, okay, maybe you are having a lot of vitamin D, but maybe your levels are still very low, so you might be supplementing with something like that. Especially if getting out into the sun doesn't do it for you in the morning and things like that. So there are certain things that are reasonably well studied. I think a lot of things are just, unfortunately, every time I see a study that looks really powerful, there's a counter study that seems to show that it's not as good. And I think a lot of it has to do with you know, the absorption of some of these nutrients into your system. It's just much better when you're getting it from your food. And so many people that don't have dietary exclusions can get a lot of these things through their food. And again, there are caveats to that, but I don't usually go on and on about different supplements if you have.
So what are a few things we should be eating, Dr. Nicole?
I think, you know, everybody's body is obviously kind of unique. So some people don't eat, you know, dairy, and some people don't eat meat, and some people don't eat these different things. But I do think, you know, heavy, you know, fruits, vegetables, you know, natural grains, as my husband will call them, happy cows. If you're going to have happy, you know, and not like farm raised protein sources and things like that. If you can get some, you know, more natural sources in that regard. But I personally think meat is, you know, fine to have, but not in excess. It's better to have, you know, more fruits and vegetables.
Yeah, we're going to. And one thing I forgot to mention, you know, of course, they're giving broad recommendations, so everyone always has to go see their physicians for their own personal health and advisement. So it's just, you know, a general, you know, overlook of just answering the questions to such a broad group that we have together. Well, thank you, all of you, Dr. Weinberg, Dr. Tal, Stacy Tenenbaum, Sandy Robertson. Thank you for making this such a robust discussion and conversation and chat. And thank you, all of you, for being here in person and all of you online. I know we have a big group, really big group online, which is fantastic. And this is going to be on YouTube for some time if you want to come back or share it with friends, because you know, I think this can really help a lot of women. And I also want to thank WUUM for having us in their space. And it's so beautiful. Thank you.
Come join us.
Yeah, come join them.
When you exit, where all the paperwork is and
Yeah.
stuff for the event, there is a WUUM calendar and a QR code, I believe. And follow us on Instagram. TikTok, Facebook. We would love to have you. We're doing some really great things, and thank you so much. I was so, it just felt like a good fit and a good space for this event to happen. And
Yeah,
so
thank you. And I have the honor also of getting to do my coaching sessions from their coaching and therapy rooms, and they have a treatment room and back, so I do Reiki there. So I just love coming here with my clients and having the opportunity to bring them here and have events. They have a beautiful yoga meditation space where they do events there too. So thank you so much. And we're going to break, but before we break for refreshments, thank you. Before we break for refreshments, Jonathan wants to say a few things.
Yes.
as well.
Thank you so much again to our wonderful panel. Thank you to all of our participants. I am just here to remind everyone that this video will live not only on our YouTube, but on a special page on our website at HAHSAH along with other resources that we work tirelessly to create, like our free 7-day Women's Heart Health Journal in collaboration with Sacred Women Collective, which has been helping so many people since we debuted it earlier this year. And we can only do this and the Women's Heart Symposium and these Hearthside Chats to continue the great tradition started by Drs. Vanderzee, and who is in the audience, and Dr. Weinberg here on the panel over a decade ago. And through your donations, we are able to do that. So if you can, please make a meaningful gift over at HAHSAH or shoot me an email and we can set up a time to meet and talk about it. Thank you so much for joining us. I hope you have a wonderful evening.
Thank you. And we have some yummy refreshments.
Yes, for those of you here, sorry online folks, we have some delicious food provided by Ulala Bakery over in Pasadena, and I have picked up a few juices and other things as well. Please do enjoy them. Stay, chat,
Mingle,
doctors.
community.
Come on over.
Community.